When you're having joint pain, it's important to go see a specialist or physician sooner rather than later because it may dictate or limit some of the types of treatment modalities that we're able to offer for you. Having difficulty going for your daily run or having a difficult time playing with your grandchildren, if that pain is enough where it's limiting those things, if you come early enough, you may be able to have more non-operative or non-surgical treatment modalities. And then if you wait a little bit longer, we may be limited as far as some of the things that we can do to kind of help whatever it is that you have going on. If you've had an injury or if you had a fracture in the past that required a surgical intervention, that can be one of the most common causes of damage to that joint and lead to arthritis in the future. Some of the other things that may lead to shoulder or knee arthritis could be if you're a heavy laborer, if you do repetitive work and you put a lot of stress on that shoulder or knee. Those things can definitely predispose you to having arthritis in that joint in the future. And then lastly, what's probably the most common thing is just genetics. You may just have predisposition to have arthritis. The good news about treatments for arthritis is that there's a lot of treatments that don't require surgery. So physical therapy can be very, very beneficial for arthritis and other shoulder and knee-related injuries. For shoulder and knee arthritis, when we get into the surgical realm, we may be considering replacement options of that joint. So within the shoulder, there's two types of shoulder replacement, and it kind of depends if the patient has a functioning rotator cuff. If they have good functioning rotator cuff or muscles in and around the shoulder, they can have a total shoulder replacement. If the rotator cuff muscles aren't functioning properly, then we typically do what's called a reverse shoulder replacement. So when we're talking about knee arthritis, the surgical treatment options can be a partial knee replacement or a total knee replacement. And that kind of depends on the amount of pain you're having and where you're having pain and where all of the imaging modalities show that most of the arthritis is localized within the knee. Within high school and college athletes, probably some of the most common injuries I see involve the knee, shoulder, and or hip. And within the knee, some of the most common injuries involve the meniscus cartilage and or the anterior cruciate ligament. Within the shoulder, in younger high school or college-aged athletes, most commonly we're dealing with injuries to the labrum and or instability of that shoulder joint. In the hip, one of the most common conditions I see is hip impingement, and that's where the athlete has a little excessive bone in or around the hip joint, and it predisposes them to tearing their labral tissue. One of the most common orthobiologics that I use in my practice is platelet-rich plasma, where we draw a patient's own blood, spin it down and isolate a portion of that blood that has a high amount of healing factors and growth potentiating factors that can attract stem cells and other types of cells within the body that help heal ligament, tendon, and bone injuries. And then as far as the surgeries go for the shoulder, hip, and knee, many of these treatment modalities for athletes are done arthroscopically and through camera surgery, so less invasive techniques. Many times this can lead to faster recovery and getting the patients back and or athletes back to play at a quicker pace. Patients say, I wish I had done this sooner because I'm, back to the things I want to do and wish I could have been doing these things, way sooner and had taken care of this issue long ago.